Good morning, ladies and gentlemen, honored members of this society. Thank you, Christoph, for inviting me to this phenomenal conference. The title of the conference, Convergences with a question mark. I like that. And the question is how the digital and the living can be combined. Now, you may not know that, but Christoph asked me to say something about myself, but I am first and foremost a physician. I take care of patients, and that's what I love to do until today. I have a large research laboratory at the Medical University of Vienna with the purpose to reconstruct extremities also with alternative means, which may be called then a cyborg. And you'll see what I mean in a moment. So thank you for the invitation. I will talk about bionic extremity reconstruction, or cyborgs ahead. What is a cyborg? Defining limits. Christoph told me there is a large audience today that may not be only limited to the biomedical sciences, so I keep it a bit broad also. A cyborg obviously is a cybernetic organism, and what does this actually mean? It would mean a true hybrid of biological and mechatronic parts. And that already makes the question mark at the end of Convergence meaningful, because how can we combine living matter with things that are totally artificial, or artifacts as it is? I'll start with a very simple truth that we all can relate to, which is how many years ago when you were born, you were a single cell that eventually came out to be a little embryo, and then you are born as a little baby. So it brings truth to the fact that we consist out of cells. And yes, it's obvious to anybody living in this century that we are cellular beings, but just reflect on this for a moment. You and I consist of 10 to the 14 cells, and these collaborate with each other to make you and me as we are today. And the most amazing thing I thought was, when I read that, is that daily about 70 billion of these die, and obviously are being regenerated. So we are in a cellular flow balance that eventually started with one cell. We grow into adult human beings, and then eventually we're going to die again because our cells are not able to keep up with the regenerative power. But what it also says, if you think of a hand or any part that you are losing maybe for whatever reason, it is not only the loss of a functionality, meaning a hand with digits that can grab something and do something with it, but it is also an irreversible loss of a cellular potential and expression. Because in the end, how do you express yourself? It is with these two hands, with your body, with your face, with your fingers, with your feet. It's the body that you have been giving, starting with one cell, growing into a multicellular organism that has its laws and principles, and with that you give expression to yourself. So we'll get to that in this talk also at the very end, but I'm just trying to get your attention to the fact when we're talking about combining the living with the artificial, we need to be aware that we are cellular beings with all these potentials with it. Now, coming to the hand has 27 bones, a number of tendons, nerves, weighs only about 700 grams. It's a very small instrument if you think of it. However, it occupies about 30% of the sensory motor cortex. I think this is significant because if you lose a hand, you not only lose a tool, if you will, but you're losing a tremendous loss of connectivity. I've just talked to Tamar in the morning and I said, if you lose a hand, what's the immediate consequence of it is your brain has a deafening silence that it has to deal with. We call this a phantom limb pain. It's a pain of the loss of a limb. So it's a loss of connectivity. This is a quote from one of the oldest hand surgeons that created the field of hand surgery, actually, Sir Sterling Bunnell, and he said the hand starts on the brain. And what he meant by that, and you can look at this screen and you can see the, oh, here it is. This is the motor neuron column of the spinal cord of a rat, obviously. But it is about 5,000 motor neurons that govern that hand. And so even if you have lost the hand, you still have the capacity to drive a hand by using this network of neurons to do that. So the hand really is a miracle of connectivity, and you'll see what that means in a moment. When I started to do that type of research some years ago, the first question I had was, well, actually, how many nerves are actually going into the hand? So I thought it's going to be a click in PubMed and I'll have the answer. And it was not so. There was not a single paper on how many afferents or efferent fibers come out or into the spinal cord. This is the only publication I found, and this was from 1933 from Sweden. And I translate here, it's the comparison of neurites of the roots of spinal nerves in frog, mouse, dog, and man. And if you read closely, they have only studied one human being. It was one 30-year-old male that they studied. They took out the dorsal roots and the ventral roots and studied these. And to your amazement, to my amazement at least, these peaks are the sensory peaks. I always thought that the rostral and the caudal tumescens in the spinal cord, the enlargements of that, are because of the multiplicity of motor neurons to drive all the muscles of your hand. But not so. It's the sensory fibers that do that. So this is an image from our own laboratory, and you see this is the median nerve. Now, the median nerve is one of the most important nerves of the human body regarding the hand. And if you look here, for example, these are the about 80,000 nerve fibers responsible for these three fingers, the thumb, the index, and the middle finger. Now, you have to imagine a single square centimeter of skin on your fingertip hosts about 7,000 mechanoreceptors. This is an immense amount of mechanoreceptor ability in a small piece of skin. And you furthermore need to realize that these sensors are every individual connected to the sensory motor cortex in a topographical way. Now, the other dots that you see here, the green ones, are the efferents, meaning the outgoing messages. Now, one thing that already becomes clear just by looking at this image is that the majority of nerves in your peripheral nervous system are afferents. We are afferent beings. Not so much efferent, but afferent beings. And so we published this in some big journals because this was new information. So the message is the hand is primarily a sensory organ, an exploratory tool, an endoscope with a visual capacity and haptic capabilities. When you are saying, let me have a look, and you're grabbing into your bag, are you having a look? You have a look. I look in my pocket and I know what's in there before I even look at it. It's a USB stick. And I knew that before I actually looked at it because my fingers can look. So that's, as a surgeon, I can tell you the fingers are the most important tools that you have in the surgery room, because very often we go into regions where we cannot really look, but the fingers are going in there and they know what they do. Would you know what that is? This thing has 22 fingers. What would it be? Anybody has a clue? It's a mole. It's a star mole. And the amazing thing, I think, is that this animal is actually blind. And with what does it see? It sees with its fingers. Yes, these are not fingers, but this is mounted around the snout of the mole, and it can make a hole in the ground without seeing anything. It hunts, it sees, it gets orientation by just getting the haptics around these 22 fingers. I'm pulling up this image just to kind of like get to the point that the hands that we're reconstructing, the body that we live in, is primarily an efferent thing. So this is a talk I've given about maybe 7 years ago, and I called it Movement is a Sensory Phenomenon. And it took me a long time to realize that really our fingers are not so much motor capacities, but they're driven by sensation. I have 3 kids. One of them plays the violin, and she plays without looking at the notes. And I asked her, I said, how do you remember these notes? And she says, Papa, I don't know, but my fingers know. And we all know that phenomenon when we're doing typewriting. Would you know where the A, B, C, Z, whatever is on your keyboard? I don't. But if I would ask you, write your name, you know how to write your name. The fingers know exactly what to do. So movement is a sensory phenomenon. Here's a small video, and you see this person has had lidocaine injected into the median nerve. I showed you, it's 60,000 nerve fibers. He's trying to light a match. It's perfect motion, but he's almost unable to do that just because he has no sensation in the fingers. I told you about the mechanoreceptors of the fingers. Here it is, Stranding 2015. It's the hand's ability is an interplay of sensory and motor capacities. That's what we have to realize. Here's a short video of a man who has lost, it's a congenital anomaly. Thank God it's very rare. He has no proprioceptive abilities, but a perfect efferent system. Can he walk? Can he crawl? He cannot even sit, just because he has no idea as to where his limbs are and how to coordinate these. So that's the only thing he can do. Now I'll show you very funny movies of robots trying to walk, and they fail miserably by just doing the simplest of tasks. Like, for example, here, this robot trying to open a door, and he's failing by trying to coordinate hands, feet, and he's just falling down. So I think I've driven the point across that movement is a sensory phenomenon. So deciphering the efferent control has been the first and foremost thing that we've tried to do in our laboratory. So here we have done a very simple thing. We call this targeted muscle reinnervation. And so what we do is we take nerves. Let's just say somebody has lost the arm, and there is the median nerve. We've just seen it before. And then we reroute that nerve into a muscle that is still available. And so when the patient thinks of hand movement, even though he doesn't have a hand, there is a muscle that's twitching. And so we have about 7,000 spinal motor neurons available in the forearm, and these we can reroute, and we use the muscle as a translator and an amplifier of neural information. We need to know the language of the nerve before we can make it of use for prosthetic control. And so that's what we do when we do TMR, or targeted muscle reinnervation. And then when we do that, we are creating what we call a manunculus. Now, we're all familiar with the word homunculus. Now, what is a homunculus? The homunculus is something in the brain. It's an area of the central nervous system that is a sensory motor interface that interfaces with the rest of our body. And so I thought, if we have lost a limb, we can create a manunculus, which is a small hand and the stump. It's very similar to the concept of a homunculus. It's a sensory motor interface. And then we have a muscle that will be able to translate neural information. We have a high-density grid to pick up that information and decipher that, and then make use of that for control. Now, obviously, if you're not listening to the muscle close enough, it's going to be nonsense information. So here we have a collaboration with an American company that produces implants. And so here we have a sheep experiment that we've done recently. And so we are injecting these sensors into the muscle after we have done a TMR, and then these sensors are able to listen very closely to the activity in the muscle and translate that information into something that's usable to control a limb. And here we have this rough EMG with all these information hidden in there with a telemetric port. You see the telemetry, similar to your toothbrush that you have and stick it onto a telemetry port. We can pick up that information and then send it into the arm. This is an experiment we've done in Imperial College just recently, and we've implanted these into the muscles of the stump. This is actually a patient that Norbert Kang operated. And then we get all this information out of the patient, and we reroute it into the machine, and with that we can govern the device. So I'll move now from this into the more clinical scenario, replacing a lost body part. And obviously, this is a guy from Niederösterreich, from Lower Austria, and he has lost an arm. So how do we deal with this tremendous loss of human tissue as it is? And so the way we do that is just for stability purposes. We do a TMR surgery that is done here. So we reroute the nerves that I've shown you before into muscles in the environment of the stump. At the same time, we implant a titanium rod into the remaining bone. And then you see the muscles twitching here. And then this is the titanium implant. And then we mount onto the titanium implant the prosthetic arm. And that is being driven then by the efferent signals where the patient thinks of elbow flexion, hand extension, and so forth. And so we can reconstruct an arm with an interface that the patient can think of intuitively and at the same time move his remaining skeleton around to make the arm of good use to him. He used to have a different type of prosthetic device that he would never wear. You can imagine embodiment is something that has to do with agency, meaning that you're able to control the individual device, but also with regards to haptics, meaning that you're able to also interface with the environment. So just to show you that this is not only an arm for laboratory purposes, but it's something that he uses in his daily life as a farmer here in the woods. So it's a very sturdy device that he can make good use of. Improving an injured body part. So we're moving a little bit away from replacing something that has been lost, but I'm not talking about maybe enhancement, but I'm just saying you have a situation like this. This young man has had an electrocution injury, and anybody who would know anything about hand surgery would know that this hand doesn't go anywhere. It's a rudimentary appendix, but it's never going to serve the purpose of a hand. So here is a student in the laboratory, and we have 6 electrodes mounted around the forearm. And you just look at the mechatronic hand, what it can do. There is collateral grip, precision grip, power grip, 15 kilograms of grip strength, it's a lot. And then very precise movement of the individual fingers and thumb. So when you look at that, and then you look at this hand, and I tell the patient, make a fist, open the hand, move the fingers, he cannot do anything. But with the signals in the forearm, the virtual hand on screen can do a lot. So I remember this young man has had about maybe 10 surgeries previously, and I said, we can try this and that and the other thing. And he says, doctor, I have a life to live outside of the hospital. I don't want to have another surgery done, but maybe we can reconstruct. It was his projection. He said, is there something else we can do? It's about 11 years ago now. And I said, yes, we can talk about that. So we had a symposium that we organized to discuss the ethical boundaries of that. And so I asked him, so would you replace that hand with a mechatronic hand? He said, yes, let's just do that. And so you see there is the MOT, because I told him if we are taking off your existing hand, we might as well just make enough space for all the mechatronic parts that we need. And so that's what we did. We amputated the arm, and we reconstructed it a few weeks later with a prosthetic hand. And I can tell you, in the meanwhile, he has 2 kids, and he's a very good in his business, and he's a great father, and he's a complete human being again, as it is. Sensory substitution. I told you about the fact that we need to get into the world of afferents. So the way we do this to complete the monunculus is by adding a skin graft to the muscle. So we add a skin graft onto the muscle, so we're having an interface not only to decipher the language of the efferent that you've just seen, but also to decipher the language of the afferents. Now you need to know that time is an issue. We need to get the feedback done very quickly. By the time a fly sits on my finger and the time I realize it, it's about 30 milliseconds. It's very quick. Now, if I would have in the prosthetic hand a sensor, by the time the actuator moves, by the time my skin reacts, by the time my brain reacts, and it's about 150 milliseconds. It's too late. The egg's broken, the glass is gone. So we need to have a quick and also colorful, if I would say, feedback from these nerves back to the brain. So here we have the muscle as an interface, and we see here the efferents going into the muscle, but also, and this would be the skin graft, we see the afferents going into the skin. And here we see what we would think of having in the end. It's an interface where we can connect these nerves, both afferents and efferents, to get that going. Am I talking too long? 3 guys having become cyborgs after getting a robotic hand. That has gone through the media, and here we see these interfaces of You need to tell me.
You have like 30 seconds left.
30 seconds left. Thank you for being so honest. I'll go quickly through that. So we have a muscle putting in as a translator. The patient can think of movement, and then that is being done with an interface, so the patient can also learn how to do that. We have a supernumerary hand for the patient to be able to realize what he can do. And I'll go through this quickly because I don't have time, sorry. And then again, we have a prosthetic device being fitted to the patient in that scenario. I'll go through this, that's my last slide almost. This patient has lost both legs and both hands, and the question is, how do we relate to that human being? Is it through the artificial hands and feet, or is it to the rest? And here's a very simple experiment. It's the rubber hand illusion. And what it tells you is that the patient relates to the hand by the sensation he gets from that. And so if you're attacking the hand, he's retracting the hand because he's thinking this is his own hand. So this is how we relate to each other. It's through the rest of the body that we have, and it is not through the artificial hand or feet. So this is the end. There were some questions. I'll go over that. I think this is a quote from Steven Spielberg's movie, Ready Player One. This body is the only reality we have, and so I think it closes the loop to the very beginning when I started. We have this body, and I think that's what we need to take care of. Thank you for your attention.